Welcome to the Lenky Yacht Podcast, a podcast about life, leadership, and money matters. Our guest today is Dr. Simon Maltais. Dr. Maltais is an artist cardiac surgeon. He has a doctorate degree in biomechanical engineering and heart regeneration. He's an international recognized leader in the world of heart transplantation, mechanical heart devices, and alternative cardiac intervention. And now he's the author of a book called Healthcare Anonymous. Put yourself first to avoid anxiety, addiction, and burnout. Dr. Marte, thank you so much for joining me today.
Thank you. Thank you for the invitation. I'm very thankful.
You know, I enjoy having this podcast, talking to people that I consider smart and that are doing something interesting in their life. But I get an additional pleasure when I speak to someone from Canada, and now even more that I'm speaking to someone from Quebec. So I'm just super delighted.
Yeah, my geographic, orientation are a bit complicated to follow, but I'm originally from Montreal. Yes.
Okay, great. Okay, so can I start by asking you how is it, or what is it that attracted you towards medicine?
I've always enjoyed studying. I mean, that was one of my things in college in Quebec. Enjoy studying, enjoy sciences, and although the path towards medicine was, I think, complicated, but had moments of doubts. You know, when I sort of switched and did a lot of research and PhD in biomedical sciences, I really liked the understanding and the physiology of the human body and the complexity of it.
Right from the beginning of your book, you mentioned that you are a perfectionist. And I wonder how much of a hindrance is being a perfectionist. Is this something that people should look up to do everything perfect, or is this something that gets on the way of getting things done?
Yeah, I have a love-hate relationship with perfectionism. In some ways, it has, and I thought about it a lot. I read books, and when I wrote that part of the book, it was a distillation of my thoughts around my own application of perfectionism and how the good part of perfectionism has helped me. So that the wanted to be the best in a certain way, wanted to complete a task very well, wanted to the parts that you want to sort of go forward always and bring the best of yourself. um, but as my career advanced, it also brought me a lot of positive things and opportunities. But the negative parts of perfectionism, so the self-doubt, the self-criticism, all those, the ego, so all of these parts have played a negative role in my life. And so while at some parts of my career, whether in training or early on in my career, it has served me, I think it has taken a lot of negative spins in some ways in other parts of my career.
Okay, well, it seems like I'm starting with the difficult questions because also another thing that I discovered early on in the book is that you were very ambitious, and you were driven not only by the desire to help others, but also the desire to be recognized as a good surgeon, the desire to have success, to have all the accolades, to be invited to speak, to have all these conferences. So I wonder how much is that of a detriment as well, to have all this blind ambition that could get on the way of your own success.
Right, Elaine, this is probably hitting the crux of my journey in this book. And to me, a career, any career, and particularly medicine, was a sprint to success. And it was how much stuff I could get done, how much accolades could I get for the greater, not a good, for the great assignment, um, and I, along the way, I just read the Will Smith book, which I really enjoyed, and it just came out. It talks a lot of, there's a lot of similarities between his perfectionism and this drive to what I've encountered in my own professional career, different topic, different areas, but very similar things. And he says something in that book, I've put down a lot of people on my way up, and I forgot that these people were going to be there on the way down. And to me, it became really a vortex, and it was to be on all the papers. It was all for Simon, and along the way, people told me, that a lot of the things were that the characteristics of individualism, or the negative characteristic of perfectionism or drive, are going to eventually affect my career. And I didn't see it until I was forced to see it, and that I was driving in this highway where I thought everybody was wrong, riding in the other direction, whether I was the one sort of driving in the one-way street.
I see. And okay, so going back into your studies, so you study right here in Quebec. How did it happen that you ended up in the United States?
Yeah, it was a combination of things. The market for work was very difficult when I finished. It sounds funny to say that, but I was a fully trained cardiac surgeon, had a PhD. I had taken on to do extra training in heart failure, heart transplantation in a Mayo Clinic. And then when it was time to come back to Quebec, because of how the system is made in some ways, the positions were very restricted because there's a certain number of physicians per hospital, depending on government assignment. And at the time, and that was like 15 years ago, it sounds funny, but it wasn't as easy to stay. And in my year, for example, in Canada, we were 13 of us finishing as a whole in 2009, and half of those people are now practicing in the United States and other places. And so, and I had an opportunity to stay, a great offer to stay at Nashville at Vanderbilt, the Help Built program for which I was trained into. So I decided to, export my wife at the time and my life over there. And so decided to leave. And Alain, when you get into a situation when you're over there and you have kids and you build some accolades and you make some friends, it becomes harder and harder to come back, to when the position opens up in Montreal.
Well, our premier, Francois Legault, he asked me to tell you that he would love to have you back.
Well, I'm my phone's open,
but okay.
I did come back in 2019, and that's a different conversation. I've had a hard time adapting to the resources and to the difficulties of practicing medicine in a public system, and I'm very honest with that. And I actually stayed for just about less 2 years, and then came back to the United States. It's about a year ago.
Okay, yes, to stay a little bit longer in this subject, do you think there's a brain drain right here in Quebec that qualified people are leaving to the United States or other countries in order to search for better opportunities?
Yeah, I think, the mentality is different. That's one. I've tried to come back, and it was much harder than I thought it was going to be to adapt to resources, the pace, the waiting lists, it got me frustrated, and it got very difficult for me to work with the system, with the resources, with partners, because of the frustrations of not being able to do your own thing and operate every day if you wanted to. And so it led for me to leave for various reasons back. And it's not a secret, there's an article that just came out in newspaper in La Presse in Montreal, where our cardiac surgeon president in Quebec portraits, the last couple of years in Quebec. And I think just off the cuff, I know of 4 people for sure, trained cardiac surgeon in Quebec in the last 4 years, that left Montreal to go work in the United States. And so 3 of them in the United States, 1 of them in Vancouver. So, it is there, it exists. And so I don't know Um, I mean, it's a touchy subject because you want to give back, you want to be at the top of your game, you want to serve the population in some ways. Um, but the reality is a bit different. And for some that the system has been like that, and that's how it works. People could wait 6 months for a non-urgent cardiac surgery. Um, for some, it's okay. I would tell you with absolute certainty that in the US, it does not happen. It just doesn't. And we don't, even in the high of COVID, most elective cases we're still going. If I book a case, it's the anomaly that I get canceled for staff or nursing purposes. I mean, in the last 15 years in the US, I think I've seen it once, and it was a major storm in the Midwest at the Mayo Clinic, and they were short staffed, and I almost had a call from the chief medical officer telling me, I'm sorry, I have to cancel the case, you know? And the 2 years I was in Montreal, I had about no, COVID didn't help, but I almost had a 30% rate of cancellation. You
Wow.
know, it was to a point where I was just stop at I was living downtown Montreal. I would stop at my little coffee shop and wait for the phone call, you know, and then walk back home, you know.
Wow.
So,
Wow.
so yeah, I mean, it's a bit on me not to have to been able to adjust and things, but it's happening. People are leaving Montreal.
Because my podcast focus a little bit on the money factor. I wanted to ask you about the student debt, especially in medicine. How much debt is involved, and how many years of servitude does a doctor have to perform in order to break even?
Yeah, it depends, you know, on a lot of things. In some ways, we're very fortunate in Quebec where most of the schooling is paid for. I know med school, I mean, it compares nothing to what people have to here in the United States get into in terms of debts. I mean, I see some of my partners are a decade out of and is still paying their 300,000 debt loan and things like that that they have to pay back. I depends for me, for example, I had to leave. I was accepted in Sherbrooke University, where you know, being from Montreal, you move away, you have an apartment, you have some expenses, and you don't have time to work. And so while the studies for me were paid for in some ways by the public, you know, government and things, you have expenses that are related to apartment, cars, and, you know, eating and all that stuff. And so, you know, it took for me a good 5 years. I had a north of $100,000 debts, and it took five to 7 years to pay that back. You know, when I started being a staff surgeon, so it does weigh in. I think one of the things I would say is while the medical faculties are better about plugging us with you know, banks that are you know, more sensible to helping us manage money and things like that. And when you're like 20 years old and you have a credit line of $150,000, it's just hard to manage, but and make right decisions when you don't have time to work or have a part-time job because you just study so much. So um, I wish some of the things I know now would have been into me at the time. You know, probably could have you know, saved a lot of money, but yeah, it's not an easy thing to be a medical student, despite everything that's being paid by the government, because you don't have time to get a job and pay for those things.
But in the United States, where student debts can accumulate to, I don't know, as you just mentioned, $300,000 and more, I guess in a way, this is part of the anxiety and burnout that doctors are having, because they cannot just take a break. They have this responsibility. They have this due bill coming every month. And you know, if they want to take a break for a couple of months, that's almost out of the question.
Yeah, and it becomes, I talk about it in the book, it's the lie of I call it pushing forward the gratification of the delayed gratification. And when you're in medicine and you're studying, so I'm putting all these hours now, and I'm accumulating all these debts, because when I finish, you know, like in 4 or 5 years, then I'll make money, tons of money, and then I'll be able to pay for it. Well, it's not always like that, you know, and it mostly, and so there's this, you become an expert. And I actually have a psychologist that talks in the book about this, how doctors become experts in delayed gratification. And then do that, and I'll be happy when I make that much money, or I can pay my debts back, or I can have this Jaguar, or I can have this Porsche, you know. And the reality is you don't, because when you finish, well, you have to pay your debts, you have to buy a car, you have a family, you have to start, you're starting a family. So there's just a lot of life happens. And so, and the salary, you know, it's okay, it's good. And that, don't get me wrong, but the time commitment it takes and everything that goes with it sometimes doesn't quite match your expectations, you know. And my observation is that we become great at delaying gratification in our life as in general, whether it's for money, whether it's for happiness, whether it's for family. And then it's a bit of a lie to think that you'll be making millions of dollars a year and being able to repay all this, because you know it's just not the case. You know, oftentimes you have junior agreements for money, so you make a quarter of what the staff surgeon does. In the US, I had a very small salary to start, at the bottom of the crowd. So I mean, I wouldn't say it was hard, but it certainly wasn't as I thought it was going to be. You know.
Okay, so I'm going to get into the topic of the book now, but before that, I have a question that is just boiling inside of my head. Heart surgery is almost becoming like science fiction. A couple of weeks ago, I heard about this human who had a pig's heart. So,
Right.
and I guess you are better informed than anybody else about this. What's the future of heart surgery? Are we going to have just be able to pick up a heart out of the shelf and just put it into a sick human being?
Yeah, I think people in my field know what this event represents for medicine, but being able to take a heart. Now, bearing in mind, I give a talk in Japan, right? I'd say 5, 6 years ago. They did not even allowed heart transplant yet, because culturally, when they said the heart was part of the, you know, so now to think that, and in the 80s, there's so much research. It was the race to who was going to be transplanting, you know, pig hearts into human. And it never worked. I mean, that research was going on for years. And so when that came out, and now he's up north of 30 days of post-operative, you know, and with and things going well, I don't think people realize how historical this moment is for patients with heart failure. It's as much as the first heart transplant, or, you know, cyclosporin for immunotherapy, or some of these, like the vaccine it's a big discovery to make it work. And if it does work, listen, in the United States, we do about 4 to 5,000 heart transplants a year for north of 4 to 500,000 people needing one. So it's, I mean, to think that you could take electively a heart on a shelf and putting into someone and that works. I mean, it's something that we haven't seen before. Now, being said, you know, heart surgery in general, I mean, who knows where it's going to go? But I mean, 10 years ago, we had to open patients for any valve procedures, and whether it was a mitral valve or aortic valve. Now we're doing mitral valve repairs with incisions that are as big as my thumb. I mean, through this with a robot, and we're putting aortic valve through the groin percutaneously, where people leave the next day, you know, and are awake throughout the procedure. So who knows where things are going to be? But I mean, I feel where other people feel like they're going to lose business, I actually feel very fortunate to be part of this evolution.
Just for the listeners, I was checking out your Twitter feed, and there's a video there of a heart surgery being performed by a robot.
Yeah.
I was just like,
and we
this
helped
is
start
crazy.
program in Montreal, and I mean, it's unbelievable how medicine has evolved. And you know, I actually think some surgeons I knew trained me that you would think would be said in a certain way, went out and learned these techniques, and now they're internationally recognized expert in robotic heart surgery. So it's incredible how things have become.
Okay, well, I'm not going to ask you any more science fiction question. I wonder at what moment or how did it manifest that you were feeling burnout? What was happening in your life and how you came to this realization that it was just not a bad week, but that this was now your sickness?
Right. And well, it was progressive. I'd say over 2 or 3 years, I started to see personal failures, professional failures, just lack of empathy. I think that was the big one for me. It's just coming to work was just another day, and I stopped caring for patients. Death and complications became just part of the job. Either patients were too sick or that's just what happened. And it's not my fault, and a lot of it's not always your fault. But and then before it would affect me, I would write it down. I had the black book, and what how can I do this different and things. And over the last 2 or 3 years, on top of having some professional difficulties, um, then that started to happen. And at the time, I would say I had that, but I was also very, very angry. Somehow everything would made me angry: a complication, a relationship issue, an interaction with a colleague. And what I know now, and realize over a couple of years of therapy, is that being angry is not normal. And it's a deep expression a of a emotion, right? So it's like, is you can't deal with a situation and then it just comes out as a burst, and that's not normal. Being angry is not normal, period. And so when I realized that, then I started to think about my journey and realize how a lot of where I was sort of a different degree of burnout, and that it wasn't the burnout wasn't necessarily the disease. The disease, and that's how I call it in the book, the burnout is the acute expression of something I've had nurtured for years that I call in the book healthcare disease, where you get caught up in things, and then when finally the burnout manifests itself, it's sort of a disbalance between things you think you were able to juggle for the last decade, um, whether it's environment, work, relationships, home interaction, home balance, finances, and it finally just explodes. And so for some it's big explosion, for some it's a small one, and for me it was sort of a progressive chip.
Right. So as you were discovering or finding out that you were feeling burnout, you also discovered that it was not just you, your colleagues as well. A lot of people, although not everyone was expressing it out loud, you discovered that many people were suffering of the same disease. So how and you concluded it's the system itself where you are working the environment. So can you explain that? How is the system creating this burnout among the healthcare workers?
Yeah, I started to talk about my personal issues, and then realized a lot of people had similar stuff or had experienced similar things and had similar thoughts about it. And the best way I could explain it is exactly how you would describe a disease. For any disease to happen, there needs to be three things to come together. So you have to have a problem yourself. So the host needs to be the problem, have to have some issue. For some, for example, it's immunosuppression, or it's, you get sick, you got some things, or you have an underlying genetic problem. So there has to be like something that comes from you. Now, and also then it factors in the environment. So for healthcare, it's the stress of the work, it's the hours, it's the perception, it's some of the cultures, it's some of the administrative burdens. So all the things that you interact with. And then the third is the what, or the way you adapt to it. So it's like this circle, this triangle of things where you have the person that has a predisposition to something or some characteristics or traits. You have the environment, and then you have the third bucket is how do you interact with this? And in any of those things, you have to have them to happen. So if you burn out, if you track it back, you can see someone that is potentially a perfectionist that works in a very high intensity environment, and then all of a sudden is taking on too much, and then boom, there's the burnout. So and you can take anybody that has struggle or challenge or has had mental health issues, and you can create this, you can create those three buckets. And oftentimes then you start to identify a disbalance between these things. And so for me, for example, it was taking on too much, being perfectionist. Ego was a big deal for me. Wanting to be doing always saying yes, because in medicine in general, it's a gift of yourself to something. But I mean, for me, it was 90% gift to medicine, and 10% for Simon, wife, friends, and other things that I like to do. And so, and it's sort of so it's an important process to realize that pie is not separated out equally, and how does it fit into your values and objectives and your career. And so sorry, it's a bit sort of it's a bit of an imaged way to represent this, and the book certainly goes in more details with this. But to me, any people that faces a challenge, and some of them it's anxiety to where they're sick, they have I have stories of people having heart attack every time they come to the hospital at chest pain, real chest pain with EKG changes and the whole thing. And when they tried all the medicine, they had even some of them had stents, and the only thing that worked is changing job or changing the way to interact with it or reducing the amount of work to treat. And so that to me, it's a big deal.
So once a healthcare worker identifies that he is suffering from burnout, what are some steps that they can do? Is working less is actually a possibility? Aren't you supposed to work 100 hours per week?
Right. Yeah, there's a couple of things. So I go into what I saw as a step recovery program. I go into 5 steps plus 1 in the book. I'd say if I maybe focus on, just for the sake of time, on 1 or 2 things that have really helped us for me. And then I'm reading this, I started to read a lot. And then I just read a book, I can't recall the author, but she called it the unicorn space. And it's funny because it really translates to what I'm trying to say in the book. It's really taking a pause, finding the space for yourself that will allow you to take a moment and do things that you like, reassess your values. And it's hard in what we do. You have cases, you have patients in clinic, you have a pace, you have objectives to meet, but it's to force yourself to take a pause. And for me, it was 3 to 6 months. And you need to create this space, and the way to do that is, for me, for example, it was to weed out stuff that didn't align with what I was trying to accomplish. If I'm trying to get some space, well, it's hard to cancel surgeries in patients, but do you need to go to this committee, this meeting, to publish a paper, to get to the student that wants to write a paper with you? So, I had all these jobs and committees and boards, and overnight, I mean, it sucked because I had to do it. It wasn't like I thought I was providing a service, but I needed to create a pause or some space. And I just sent out an email overnight, say, okay, I'm thankful for the opportunity of being president of this and board member of that. But I just, as of today, I'm resigning. And then I think you should try to find somebody. And the moment I did that, I was expecting some angry emails and things, but it was the opposite. It was like, well, I hope, you're taking time for yourself. We hope you'll find the space to get better, and we'll be ready if you want to come back. So creating space, that's one. I think the next step is to virus scan yourself on a regular basis. And I call it virus scan, the link with medicine. Some people would call it find a moment for gratitude, or finding a time to, during your busy day, to assess how you feel. And that sounds funny because I do it during the day after my first case typically, and around lunchtime when I have time for myself. And I say, how do I feel right now? If I close my eyes and I assess what do I feel. And I discovered breath work, which is amazing, but it could be a whole other conversation. Um, and if I feel anxious, if I feel like everything's standing in the mouth here, if I feel like then I need to reassess something. Do I need to reduce patients in clinic? Do I need to space out the surgeries? Do I need to take time for myself more? Do I need to maybe see the therapist, do something, so, and if you do that every day, then you end up being on a path of recovery. And that has to be based on, that pause you made for yourself to sort of reassess where you're going, what's the best scenario at work for you. Because to come back to your initial thought, not everybody needs to leave the profession. In order to heal from, let's say you have diabetes, right? You can't get away from it. And I think I see healthcare disease the same way. I mean, you train, you work in an environment, you're exposed to it. So you just have to realize that this makes you sick. And so therefore start acting upon it. If you let diabetes, untreated, you'll get sicker and it will, it will catch you back. So it's the same thing. And realizing that you have this chronic problem or interaction with work or trait of personalities that sort of clash a little bit with what you're being asked to do or what you're willing to do. And then progressively virus scanning yourself on a daily basis kind of makes it slightly equivalent to measuring your sugar on a daily basis, right? So that's one. And I go into more details into a couple more things, but I think if I would have to identify two things that continue to be part of an active recovery for me, it's to find this quiet space or create this unicorn space. That's a new term because I'm reading that book. And then to find time to virus scan yourself.
And being that there is so much demand for your time, I don't understand how come you wrote this book. Writing a book takes a lot of mental, emotional effort.
Right. Yeah, I as part of my recovery, I started journaling a lot, and mostly for me, but I'm going to take another quote from a book, but to see the green lights and what am I doing when things are going well, not what so journaling when things are not going well is not the key. So it's to find what you're doing when you're hitting green lights, Matthew McConaughey's book. So when you're hitting green lights, then you go back to what you're doing and say, what was I doing then that worked, And so I started to write, and all of a sudden things started to emerge and started to organize themselves. And I started to put it together as a book. I took a school, a course on how to write, ran some master classes, and listen, if you write 1,500 words a day in the morning, after 60 days, you have a 250 pages book. And so again, it's like anything else. It's just like committing to something that you truly believe in.
Wow. Okay, well, the last question is, can you tell us one more time the title of the book and where can the listeners follow all the work that you're doing?
Yeah, so with I'd say three-prong approach. So Healthcare Anonymous is the title of the book. You can find it on all the major distributors, Amazon, and it will be available on release to all the Barnes and Nobles and things like that. We have it on healthcareanonymous.com. You can go on there and pre-order the book or pre-order a visit. I have this program on there that I visit and talk about the book, give a presentation, things like that to help people make actions towards something better. We have the book's going to be translated in French. It's going to be called Code Blue. It'll come out in April in Quebec as well. So I'm very excited about that too. And we also are starting with a few of my partners. We're taking action to help people. So breakthroughpoints.com is a site where you can go and where we plan on helping people with coaching services that are either in training, that want to do breath work, that are looking for advice into high performing environment, expanding healthcare to athletes, and people working in business and things like that. So we have partnership with people that are within those milieu to try to help them directly. So
Could you repeat that website one more time?
breakthroughpoints.com.
Okay, well, Dr. Maltais, thank you so much for your time. And I wish you already got all the success in the world, but I wish the success for the book. Thank you.
Different path, but thank you for the invitation. I really appreciate it. Thank you so much.
Until next time.
Yeah.